Tom, I want to start with you because we have these new findings from the FDA now on the Moderna vaccine. And it shows, the data seems to show that it doesn't just stop you from getting symptoms. It actually might also stop the infection itself. That's something that experts hadn't been sure about, and it could be significant, right, in stopping the spread of the virus.
Yeah, and we should make it clear we're talking about now the second vaccine. So this is very good news. The FDA suggesting that they could grant emergency authorization as soon as Friday for a second vaccine, this one made by Moderna. And you're right. I mean, not only does it seem to be up to 94% effective, it also seems to block the infection itself. So not just keeping you from getting symptomatic, but blocking the infection. And that's critical. What we still don't know about either the Pfizer or the Moderna vaccine, although this evidence may suggest it, the question has always been, if you get the vaccine, could you still shed the virus, spread it to somebody else, or are you protected not only yourself, but protecting somebody else? Now, this evidence from Moderna's FDA application might suggest that, in fact, you would not spread it, because if you can't get the infection, in theory, you're not going to spread the infection. So that could be very good news indeed. Now, we do know that the Moderna emergency authorization expected probably on Friday, and then it would start rolling out over the weekend or next week. And what's really critical about the Moderna vaccine is that it does not require that deep cold freezer temps at negative 94 degrees Fahrenheit that Pfizer's vaccine requires. And also, there appears to be more of the Moderna vaccine already in the system and ready to be rolled out. So this could be really helpful, especially in those remote communities around the country. For example, not big cities, but in the corners of states where they don't have big hospitals with those deep freezer capabilities. This could really be helpful there. And then lastly, I do want to point out, that's Moderna. On the Pfizer front, the Operation Warp Speed commander is now suggesting another 4.5 million doses of Pfizer's vaccine probably will be released on Friday, probably start rolling through the system over the weekend and into next week. So we really are in a situation where we have just a cascade of doses now starting to move through the system.
It does feel like a ramp up. And Tom, this needs to happen, right? Because in order to get to the numbers, the many millions of shots that need to get into arms, you have to have more vaccines than just Pfizer, right? It's a numbers game here.
Yeah, and we expect, by the way, another vaccine in January or February. That would be Johnson & Johnson. AstraZeneca's vaccine expected maybe February. But you're right. You know, every expert has said we need 75 to 85% of the population to have been vaccinated to achieve what they call that herd immunity. Now, what's critical is what percentage of the country will feel comfortable getting the vaccine. And there are new numbers out this morning suggesting that's inching up, that we're now up to around 3/4 or so of the population becoming more comfortable with getting vaccinated.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.